Hi, my name is Daphne and I'm a patient of Dr. Haddock. Feels like a long journey. It's going on 14 months now from when I got diagnosed with stage 0 breast cancer and then did some genetic testing and found that while I didn't have the BRCA gene, I did have the CHEK2 gene. So once I found that out, I decided for me that I would want to do a mastectomy. And actually in California, my husband and I did quite a bit of research and came across Dr. Haddock and Dr. Farr and came out here, had a consultation with them, and it was one of the best decisions I made. Had amazing care here at UT Southwestern. And you know, it is a bit of an overwhelming process, the surgeries it took to get here, but just trust the process and it does all work out in the end, and I'm so very happy with my results. Yeah, I mean, we were very fortunate. It was, you know, just one nonstop flight on Southwest, so fairly easy process to just fly out, and everyone here is so helpful and supportive. They can even recommend local hotels in the area. The care here is amazing. I mean, I've had great care, but the care here is amazing. Everyone here treats you like you're their friend, like you're their family. They're also very sweet, helpful, genuine. The equipment here is amazing. The test results, the response time is exceeded any expectations that I had. When I found out that I had stage 0 and I had a genetic component, at home we went over the various options that included things like radiation, hormone therapy, a lumpectomy. I did my research, I asked a lot of questions of the care team, and I decided that I wanted to go the robotic route. And this was one of 2 places in the nation that was doing that. I did need to have a lift and reduction to qualify. So I had that with Dr. Haddock. So then about 6 months later, I had the mastectomy with Dr. Farr and Dr. Haddock. And both procedures went amazing. I didn't have any complications. You know, they're still not fun. Having surgery isn't necessarily fun, but neither is having cancer progress. So between the 2 options, I would pick the option that I picked again and have that mastectomy with Dr. Farr and Dr. Haddock. And so as part of the journey, I had a lot of options, and Dr. Haddock was so patient with all of my questions, as well as his team. His team is amazing, so it can sometimes be a little bit hard on the spot to think of all the questions you want to ask, or perhaps after you've learned some information and go home and research, you find that you have more questions. And so I just sent a my chart message to the team, and they were always very responsive, very friendly. I had the choice between doing the DIEP flap that he specializes in, as well as implants. And so that was, for me, that was a hard decision. There's definitely, it's personal decision that you'll make, but just being able to ask those questions and being given that time to process it and decide. He even offered, and I was able to talk to some previous patients and regarding their experience. And so I did end up deciding to go with the implants. Yeah, so when we did talk about doing the DIEP flap versus the implants, we went over all the various things that would entail. So in doing the DIEP flap, it's a little bit longer of a procedure, a little bit longer of healing time. You are having 2 areas, you know, your abdomen in that case, as well as the breasts that are gonna need to heal from that surgery, versus the implants, you know, the abdomen you're leaving alone. You can have some fat grafting, which it did have done. But yes, the implants are not gonna last forever. I understand that, and they'll go over, you know, all of that with you. But I think now with technology, implants are lasting 20 years. And so to think, okay, 20 years from now, 15 years from now, I'm okay with that. And that exchange surgery eventually, probably pretty quick and easy surgery. I really did struggle with making the decision, and looking at Dr. Haddock's work, which is on his website, on the Instagram, both results looked amazing. And it's a very personal decision, so I wouldn't want to really sway somebody one way or the other. And I will say his team's very good about not swaying you one way or the other, because it's your decision. And I don't want to use the words pros and cons. There's just differences between the 2. And so one's using your own tissue, but it's definitely a more involved surgery, again, that he specializes. And so if you're going to have it done with anyone, I would say definitely have it done with him. But for me, what ultimately had me go the implant route is I had 5 surgeries to get here, and I just wanted to be done. And so it was just a quicker recovery time. I kind of liked the idea of things just staying put with your natural tissue. You know, it is going to feel more natural, look more natural, maybe age a little bit more naturally. But with the implants, I really wanted that quicker recovery time just to get back to living life. And 5 years from now, maybe, if it doesn't feel like you thought it would, you can revisit, the other procedures that they offer. Because, they have the DIEP flap, I forget, like the PAP flap, the lap. There's lots of different ways to use your own tissue. And again, Dr. Haddock specializes in that. He's amazing at that. But for me, what ended up, I think, ultimately persuading me to go the implant route was I just wanted to be done. I am young, I'm healthy, I could recover from both surgeries just fine. But I really just thought, this is the easier of the two surgeries. Let me just try that and see if it works and I'm happy with it. And I did, and I am. It's a very personal decision, but the team is just so amazing, and working with you throughout that whole process and answering the different questions that you have. And again, talking to other patients was really helpful. Through someone that actually experienced it, see what they feel and what they recommend as well. One of the things I found extremely helpful throughout this process was going on Facebook and joining a couple groups, so specific to your situation. And so for my situation, it was DCIS, ductal carcinoma in situ, and it was stage 0. So I joined a forum not related to Dr. Haddock, but just related to women in that particular category. And I just kind of observed the questions that they had, the thoughts that they had, and that helped me come up with my own questions. It's gonna be very specific to where someone's at and their specific journey. How many surgeries am I gonna need? What's recovery time gonna look like? I know that was something that I was nervous about, being from California and traveling here for care, trying to plan, well, when can I fly home? How long should I stay here? How long do we need someone to watch the dogs back at home? And so every recommendation was completely spot on. I tend to be one that likes to overplan. So we would usually, even if we could go home a little earlier, we'd stay out here for about a week for that post-op check-in. So one thing I would say to a new patient of Dr. Haddock's, especially someone that maybe has my particular background, is it's overwhelming. You have a lot of feelings, emotions, a lot of surgeries to maybe get to the final result, but just trust in the team. They are truly, truly amazing. You will be happy in the end. They will work with you, answer all of your questions. They're so incredibly patient. If you're in the appointment and you forget a question, you can always MyChart them, and they are so prompt at getting back to you. I know when I first came out here to get to my final result, I had a few surgeries to get here. I had a lumpectomy to get clear margins, and then the lift and reduction, then the mastectomy, and then the exchange surgery with Dr. Haddock. And so it is a journey, but the whole time I always felt that my needs mattered. The team truly cared about me. Being from California, as things heal, I had questions and I would take pictures and send them, and they would reassure me or let me know what to do. It really was amazing care, and I'm so glad that I chose to go here, and I'm really happy with the results. So I would just say, as much as you can, trust the process. His team is amazing. And as far as Dr. Haddock, thank you. Thank you so much for the work that you do. It truly is incredible. You're so very patient, so very knowledgeable, so approachable, and you have an amazing team that backs you up. And so I just truly appreciate you all. You are so genuine, so helpful, so kind, and so grateful that I found you all to have my care. I think had it come up, I would have sent a message, and if there was something of concern. But so my care started with my team at home. When I had the lumpectomy and they found the DCIS, and then we did the testing back home for the genetic component. And at that point, I had a lot of choices. So I could do the radiation and or tamoxifen, hormones, or the mastectomy. And so when I had decided I wanted to do the mastectomy route, that's when I did speak with a surgeon back home. I also got a second opinion at UCSF, and ultimately decided if I was gonna do the mastectomy, I wanted to do the latest and greatest technology. And so to me, that was the robotic that they do out here, Dr. Farr and Dr. Haddock. I had like little concerns, as I think you will through having surgery and just the healing process. But I knew if I had anything going on back home, I could definitely go to my physician there and get assistance.